Hi, it's Bob Boross, and this is my Jazz and Tap Dance Life. I'm here for an update on my knee replacement surgery, and right now I am in day 21, 3 full weeks after having the replacement done on June the 14th. So in my last update about a week ago, I think I mentioned a little bit about how things seem to be a little bit slower than I wanted them to be. Like there was progress, but there still was not overall progress. I think in this last week I've started to break into getting more progress in terms of how the knee bends. So I'll talk a little bit about that later on. That's more in terms of the new physical therapy that I'm going through. But my big thing last week on Thursday, which was July 1st, I was back to the surgeon to check out the incision. And then I had my first outpatient physical therapy, not at home, but outpatient, which was a lot more intensive and brought a lot more results for me. So anyway, let's get to the good stuff right now. I'm going to share my screen. So let me pull this up. And here we have the knee. So this is the knee. Actually, this is what it looks like right now. The doctor pulled off the long Band-Aid. I should have taken a photo at that point. But as you can see, the swelling is down considerably. And he put these small strips over just to hold. He says, now I don't have to wrap it with saran wrap when I take a shower. It can get wet. He says these will just fall off on their own when they need to. So you could see the incision through there. The incision is actually held with a glue. This is not stitched in. There are stitches more towards my shin and towards the upper thigh where it's stitched in the unit that held the robotic arm, but that long incision itself is actually only with a glue. So hopefully it's going to be a little bit tighter and certainly not as visibly Frankenstein type of scar that you might have seen in the past on people with this type of surgery. But he was very happy with it, said it looked great, and it was a quick visit. After that, we went into the x-ray room. So this is what I now have. So right over here, we can see the implant on the left knee. There's a big chunk here section that went into the tibia. And then from here we have a flat section on the bottom, and it's kind of like a spike that goes down lower. That spike going down, I think I feel that probably more than anything else right now, because I will feel it down into my shin and almost into my ankle. But that is what was done there. That was all new parts. This is a plastic type of filler piece right in here that will give the cushion between the two joints. And I'll show you a side view in a second. Now, if we look to the other knee, this is actually, even though it's on the left side, it's my right knee. If you look to the outside, you can see a good amount of distance between the upper and the lower bone. So that meniscus it's better. But if we look to the inside, we can see how that distance is very minimal, and that's where I'm having the problem on my right knee. This section on the left was even worse. That was actually touching. So this is what it's all because of. If I would have had this same width of meniscus as I had on the outside, if I would have had that on the inside, I probably would not be having all of these problems and have had to have this done. So that's where it all comes from, and I would really like to study what I do in jazz dance a little more that tells me why, with this 45 years of dancing, does this happen on the inside of the knee, yet it doesn't happen on the outside of the knee. Okay, now let's go to the next x-ray. This is the side view with a slight bend. There you can see that really flat piece that was put into the lower bone and that big spike that went down into the center. You can see a little bit of an outline of a pad filler that's in there. And then the upper bone will slide, not bone, but that's the implant, will slide on that piece. Here you see the patella, or the kneecap, and a lot of times with people you get a grinding and arthritis behind the kneecap from years and years of sliding over the bones, and that can give you pain. So if you can see, I can't blow this up, but there's just a little bit of a pad that he actually put in there. Maybe it's just glued on. So that's just a little pad so that it'll bypass that arthritis that's behind the kneecap. So that's what the joint looks to the side. So this is why it causing me a lot of pain. And this is why it takes months and months to recuperate from this, because all of the muscles and the healing of the bone, it just takes a long time for this very invasive surgery to take its course and to heal and the swelling to go down. And then after that to develop the normal muscular function that you would have. So anyway, that's what was done. Now I do feel better now. And on that same day of July 1st, I had my first outpatient physical therapy. Hour and a half. Almost all about bending the knee, which it doesn't want to bend. It just stops. You know, the whole quadriceps, it just stops. It will not bend. One thing that kind of was good because it got things going, but it was murder. My therapist, she had me and was bending my knee. I was laying flat on the table, and she's bending my knee in towards my chest to where I couldn't take it, and I've got my eyes turned and my eyes closed, and I'm making grr noises, and she goes, all right, a little bit more, and she just went for it and really pushed it, which really is supposed to, whatever this developing scar tissue, it just breaks it. Let me tell you, I had some expletives underneath my breath coming out, quite a lot. She held that position probably for 5-7 seconds and backed it off, and then said, okay, only 3 more to go. Wow. So anyway, had to grin and bear it, had to make my way through that. And then, of course, many other exercises that had to do with the bending of the knee. But that one was definitely the worst. But I have to say, after that, later in the day, my knee was bending a little bit more. So that was on a Thursday. So Friday and Saturday, you know, I worked on it on my own at home. Today I worked on it again, and I can feel that it's actually bending a little bit more. It certainly is not bending a lot, but it's a little bit more. So there's progress. It's very slow, but you've got to go through a lot of the pain to make this happen, to get it to where it starts to bend again. I'm sure like once you get over the hump, then it will get a little bit better. So I'm hoping with another week or so, it's going to have a decent amount of flexibility, and maybe the pain won't be there as much. One thing I talked about in my last video too was this pain that I had in my hamstrings all the way up to my hips and on the side, the IT band. And speaking with a therapist about that, and also the doctor, and they just kind of feel that, I mean, it's because of the surgery, but also like using the walker, because you tend to like reach the walker and then take 2 steps and reach the walker and take 2 steps. So you're constantly just like gripping every time you take a step. By Thursday, I was able to graduate to the cane, which probably I should have done a little bit longer or a little bit earlier. The cane is much better because you do take a graduated fluid motion as you step. It's not a stopping motion. And within 2 days of using the cane, I really don't have that hamstring issue, that hamstring extreme discomfort that I would have before. So that's a good sign. Sleeping is still a problem. I sleep 1 to 2 hours at a clip, and then I have to get up. I have to go onto the sofa. I have to get up and walk around. I have to put ice on it. And so I'm just doing like 2 hours and then an hour up and 2 hours, an hour up. So I still have not slept straight through the night in 3 weeks since I had this done, day 21. So I'm hoping that that's going to get better. The pain pills, the oxycodone, I'm down to usually 2 a day. And they tell you to take 1 before your therapy because it's going to hurt. So I'm taking 1 for that. And then I'm pretty good through the rest of the day. When I go to sleep at night, maybe I'm a little bit worried about it, so I'll take 1. Or last night I went to sleep first, and then when I woke up it bothered me, and I took another 1. So that's down to 2, whereas before I was taking 4 to 5. So that's a good drop. I'm very happy about that, and I want to get that down to where that's eliminated from the scene. So anyway, that's where it is on day 21. You know, it's looking better. I'm kind of getting over the hump of where I'm walking easier. I'm able to get out. I actually, even this week, because my car has a manual transmission, which means you use your left leg on the clutch, and I just had my left leg done, so I can't do that anymore. So I need to get another car. And on Wednesday, I found a car I wanted online. I took an Uber up to Parlin, New Jersey, about 40 minutes away, bought the car, you know, using my walker, and drove it home and got home. And I've been out to physical therapy, the doctor, etc. Took a little trip yesterday. So I'm able to get out and get around. So I'm feeling way better now than I did a week ago. So that's good. So I feel a little bit more like a normal person now and not just a patient laying there in pain. So anyway, that's where I'm at now, day 21. You know, I've got another week or 2 weeks of this stretching of the knee. At that point, if it works a little bit better, you know, then I can maybe start to graduate into a little bit more full body movement. Oh, that's one thing I'm doing also. I'm working on just some dance exercises, you know, half toe press, half toe down. It's really hard on my left foot. It's really kind of stiff in there in the toes. Parallel tendus, front, side, and back, just to stretch to work the leg, and a nice little squat and round over, like I can hold my hand on a counter and round over round the back and wiggle the hips side to side. That feels good too. So I'm starting to get into a little bit more movement. So anyway, 21 days of this, it's starting to turn the corner. It's feeling a little bit better. So that's where I'm at now. So hopefully next week I'll come in with another video and talk about how wonderful it is to walk a little bit easier and how the pain is a little bit diminished from where it is now. Okay, so that's where I'm at. I'm Bob Boross. This is my jazz and tap dance life on day 21 of my recovery from full knee replacement surgery. Thanks so much for watching. Please subscribe, hit that like button, and I'll see you in the next video.